Did you know that our bodies are not capable of producing vitamin B12 on their own? Any person can develop vitamin B12 deficiency at any age. People who are 60 years old or older are more likely to have vitamin B12 deficiency compared to other age groups. Vitamin B12 deficiency can tingling sensations dancing in your hands and feet, a persistent weariness that seems to cling to you no matter how much you rest, a noticeable weakening of your muscles, digestive troubles like constipation, a diminished desire for food, and an unexplained drop in your weight. What could possibly link all of these seemingly disparate symptoms? Vitamin B12 deficiency is a treatable condition that happens if you aren't consuming enough vitamin B12 in your diet, or if your body isn't absorbing it properly. Vitamin B12 deficiency can cause physical, neurological, and psychological symptoms. It can be treated with vitamin B12 medications. Vitamin B12 deficiency happens when your body is either not getting enough or not absorbing enough vitamin B12 from the food that you eat that it needs to function properly. Vitamin B12 is an important nutrient that helps your body make red blood cells and DNA, the genetic material in all of your cells. Untreated, vitamin B12 deficiency can cause physical, neurological, and psychological problems. Surprisingly, is often a deficiency in a crucial nutrient, vitamin B12. This essential vitamin, also known as cobalamin, plays a vital role in numerous bodily functions, and certain groups of people are more vulnerable to not getting enough of it. These include older adults, individuals with underlying gastrointestinal conditions that hinder nutrient absorption, those following vegetarian or vegan diets, and women who are pregnant or breastfeeding. So, today, let's delve into the world of vitamin B12 and understand why it's so important for our health, making it an essential nutrient that we must obtain from our diet or through supplementation. This vitamin is absolutely critical for several key processes, including the formation of healthy red blood cells, maintaining proper neurological function, the health of our nerves, and regulating the synthesis of DNA, the very blueprint of our cells. So, how do we detect if someone has a vitamin B12 deficiency? When a deficiency is suspected based on a person's symptoms and risk factors, the first step is usually a simple blood test that measures the level of vitamin B12 in the plasma, the liquid part of the blood. The typical normal range for vitamin B12 levels is considered to be between 170 to 250 picograms per milliliter, pg per milliliter, or using another unit of measurement, 120 to 180 picomoles per liter, pmol per liter. However, it's important to note that these ranges can sometimes vary slightly between different laboratories. Because vitamin B12 is so crucial for the production of red blood cells, a deficiency often leads to anemia, a condition characterized by a lower than normal number of red blood cells. In the case of vitamin B12 deficiency, the anemia typically presents as a specific type called megaloblastic anemia. This term refers to the fact that the red blood cells produced are larger than normal. However, despite their increased size, these abnormal red blood cells often don't contain enough hemoglobin, the protein responsible for carrying oxygen throughout the body. On the other hand, if a person is also deficient in other vitamins or minerals that cause red blood cells to decrease in size, such as iron deficiency leading to microcytic anemia, where red blood cells are smaller than normal, the picture can become more complicated. In such cases, simply looking at the size of the red blood cells in a standard blood count, hemogram, might not be enough to easily diagnose a vitamin B12 deficiency. One deficiency might be making the red blood cells larger, while the other is making them smaller, potentially masking each other's effects. There is another blood test that is often considered more sensitive for detecting vitamin B12 deficiency, called a homocysteine test. Elevated levels of homocysteine in the blood can indicate a problem with either vitamin B12 or folate, another B vitamin, also known as vitamin B9 deficiency. However, these homocysteine tests are often more expensive than a standard vitamin B12 level test and might not be routinely ordered. Regarding how much vitamin B12 we need on a daily basis, both Health Canada and the Institute of Medicine in the United States recommend that for individuals over the age of 14, the ideal daily intake of vitamin B12 is 2.4 micrograms mcg. This is a relatively small amount, but it's essential for maintaining proper bodily functions. So, where can we get vitamin B12 from our diet? Animal products are generally the richest sources of this vitamin. These include fish, meat, especially red meat and liver, poultry, eggs, and dairy products like milk and cheese. Vitamin B12 is generally not found naturally in plant-based foods. However, there are some fortified foods available, such as certain breakfast cereals and nutritional yeast products that have cobalamin added to them. Interestingly, beef liver contains one of the highest concentrations of vitamin B12, and for some individuals, consuming it, even just once a week, might be sufficient to meet their needs, provided they have normal absorption. However, this brings us to a crucial point. Some people have underlying gastrointestinal problems that interfere with their ability to absorb vitamin B12 from the food they eat. Because vitamin B12 is essential for red blood cell formation, this malabsorption can lead to a specific type of anemia called pernicious anemia. Pernicious anemia is specifically caused by the impaired absorption of vitamin B12 in the gastrointestinal tract, often due to a lack of intrinsic factor, a protein produced in the stomach that is necessary for B12 absorption in the small intestine. In cases of pernicious anemia or other conditions causing significant vitamin B12 malabsorption, simply increasing dietary intake might not be enough. For these individuals, there are typically two main treatment options: sublingual vitamin B12 supplements, which are dissolved under the tongue and absorbed directly into the bloodstream through the mucous membranes in the mouth, or intramuscular injections of vitamin B12, which bypass the digestive system altogether and deliver the vitamin directly into the muscle tissue for absorption. On the other hand, if a person has a vitamin B12 deficiency, but their stomach and intestines are functioning normally in terms of absorption, then the deficiency can often be corrected by either consciously including more vitamin B12-rich foods in their diet, or by taking oral vitamin B12 supplements that are ingested and absorbed through the usual digestive process. It's important to talk to your doctor or a pharmacist to determine the correct dosage of vitamin B12 supplements for your individual needs. The appropriate dose can vary depending on the severity of the deficiency and the underlying cause. While it's generally good news that vitamin B12 deficiency can often be corrected, meaning that blood levels can return to the normal range with appropriate treatment, it's crucial to be aware that any damage that the deficiency has already caused to the neurological system can sometimes be irreversible, and this can include persistent pain. Therefore, even if the blood levels are corrected, supplementation is often still recommended to prevent further neurological deterioration. There is some emerging evidence suggesting that vitamin B12 might play a role in the treatment of certain types of neuropathic pain, nerve pain, and even low back pain. But more robust research is needed to definitively demonstrate these benefits and establish clear treatment guidelines. In severe and prolonged cases of vitamin B12 deficiency, the neurological and systemic effects can be quite significant. These can include not only the numbness and tingling we initially discussed, but also more serious issues like depression, visceral disturbances, problems with internal organs, psychosis, dementia, glossitis, a red, beefy, and often sore tongue, restless leg syndrome, paraplegia, weakness or paralysis of the legs and lower body, and even incontinence of the bowels and bladder. This underscores the importance of recognizing and treating vitamin B12 deficiency promptly. If you are prescribed or considering taking vitamin B12 supplements, it's always a good idea to talk to your pharmacist, as vitamin B12 can interact with certain other medications. Some of these include proton pump inhibitors, PPIs, and H2 receptor antagonists, which are commonly used to treat stomach ulcers and acid reflux, as well as metformin, a widely prescribed medication for managing type 2 diabetes. These medications can sometimes interfere with the absorption of vitamin B12. Finally, I want to remind you that the information provided in this video is intended for educational purposes only and should not be considered a substitute for professional medical advice. If you have any health concerns or suspect you might have a vitamin B12 deficiency, please consult with your doctor for a proper diagnosis and personalized treatment plan. And in the event of a medical emergency, please seek immediate medical attention by going to the nearest emergency department. If you found this video helpful, please give it a thumbs up. Don't forget to turn on the notifications so you don't miss any of my future videos, and please subscribe to this channel for more health-related information. Thank you so much for watching, and I'll see you in the next video. Goodbye.